Hello and welcome. My name is Sharif Yaqub. I'm an endocrinologist and the CEO of a consulting company called Azinor that aims to help professionals achieve best efficiency with the documentation and with the use of technology. Now, this video is made specifically for my colleagues, the surgeons. Let me ask you, how would you feel about making an additional $1 million over the span of your career with minimal change and minimal effort in the way that you do things? Sounds too good to be true? Not so. Over the span of the next few minutes, I'm going to show you exactly how to do that. And it will involve slight change to the way that you do documentation in your clinic note. Let's begin. Let us pretend that you are an orthopedic surgeon who is seeing a patient for right knee pain. You decide the patient needs to have right knee replacement, but you also notice that the patient has medical problems, maybe diabetes, hypertension, smoking, that are not controlled and that hinder your plans for surgery. So you tell the patient to get in touch with her primary doctor and to arrange for those problems to be addressed. Now, you do that because of your care for the welfare of your patient and because you want the surgery to be successful with good recovery and healing. However, you may underestimate the effect of what you are doing from the billing perspective, because the difference between a level 3 note and a level 4 note is $40 per patient. That might not seem like much, but it adds up. In fact, billing experts have said that if you miss one patient, like I just mentioned, and that you don't do the documentation right, you underbill or undercode, and you bill for a level 3 when in fact you could have billed for level 4, you are missing $9,000 in revenue every year. Now, you and I know that you probably see a lot more than one patient per day with the descriptions that I just mentioned, maybe 4 or 5 at least. That means about $50,000 that you're leaving on the table every year, and over the span of your career, more than $1 million. Now, you may say, hold up, I understand what you said, but I don't want to spend my time in documentation. I don't want to spend an additional hour every day documenting. And I completely understand you're better off spending that time in the OR. And that is why I'm not asking you to spend an hour or even a minute documenting things that you do additionally. All I'm asking is that you do a few clicks, like I'll show you how, and then you can capture all that revenue. On this note, as I use this example, the complaint, history, present illness, all the history, review of system, exam, everything's going to be the same like you normally do. The difference starts with the assessment, because you have to write down the assessment and mention the assessment of any medical problems that affect your management or your plan for your surgery. You probably will find it already on the problem list there for you, whether it be diabetes, hypertension, or smoking or other things. You just, by the click of a mouse, bring them into your assessment. Then you move on to the treatment section where you do the bulk of your documentation. I made macros for you, and macros are simply shortcuts, if you will, to large texts of documentation that require simply the click of a button to bring to your treatment section. The code we're going to use is the hashtag. Once you put in the hashtag, it will open up the menu for you to use. If the problem is uncontrolled diabetes, you just click this. If it is blood pressure being high, you click this. If the problem is smoking, then you also click here. Let's say that you spend some time talking with the patient's primary care doctor about the case, asking them to get the diabetes under control. Well, in that case, you need to document this because it's very important. It's called coordination of care, which counts a lot when we are doing the billing and coding. This discussion per se can be, again, documented with the click of a button. But if you are spending 40 minutes between discussion with the primary doctor and documentation and talking with the patient, then that takes the level even higher to level 5 instead of level 4. And in that case, you can just click this one and it says 40 minutes were spent on the case and 50% of time was spent on patient education and coordination of care. When it comes to the billing, you simply choose the billing that is appropriate for what you documented. If it is level 4 or level 5, as you spend the time for the case, and then you click OK. And even if you counsel the patient on smoking, meaning that you told her smoking is not good for her and that she needs to stop it in anticipation for the coming surgery, maybe offered some insight about what she can do about it, you can do that CPT code, which is 99406, and that documents it and helps you also get additional revenue. Now, I hope that this has been simple enough for you to use, but at the same time, do not underestimate the impact of those simple changes in making a huge difference in your income and revenue, not to mention patient care. I hope you enjoyed this video, and if you have any questions, please let me know, and I'll be glad to address your concerns. Thank you, and you have a great day.